We're at the annual meeting of the North American Menopause Society, and I'm speaking with
Hadine Joffe.
And you are?
I'm a psychiatrist. I'm an associate professor of psychiatry at Harvard Medical School, and I'm a physician and clinical researcher who focuses on menopause medicine at Brigham Women's Hospital and Dana-Farber Cancer Institute.
And yesterday I heard you talking about sleep and menopause. How big a problem is sleep in association with menopause?
Yeah. So unfortunately, it's a very big problem. About 40% of women will experience some sleep problems as they transition, and some of it is age-related, but the menopause transition itself is a major contributor because of the hot flashes that are so common, and people wake up repeatedly throughout the night when they do have a lot of hot flashes. And that leads to unrefreshing sleep and fatigue and can contribute to daytime low mood and other functional changes.
So is sleep mostly falling asleep, waking up, or what do you call sleep problem?
Well, what's distinctive about menopause-related sleep problems is that it is a sleep maintenance problem. Women usually don't have trouble falling asleep. They don't worry about whether they will be able to sleep, but they wake up uncomfortable, hot, sweaty, annoyed, and sometimes have a hard time going back to sleep. And there are different factors that bother people. Sometimes it's the physical discomfort and the heat sensation. Sometimes it's not being able to get back to sleep. But for those women who wake up repeatedly, over time, it's very distressing.
What can they do about it?
So there's several options. One is to be aware that it's not normal, that it's not a normal part of the transition to be tolerated, to be put up with.
You don't have to grin and bear it.
You don't have to grin and bear it. And it's amazing to me how many people just assume that this is the way life goes. There are things that can be done about it. And it's not that it always bothers people forever, that they have to treat it forever, but there are some very important strategies. So one is, of course, bedroom comfort, and so reducing the temperature, wearing pajamas and bed covers that are not heat-inducing, and people keep fans on. Those are easy to implement strategies that can make a big difference. Trying to eliminate any other problem that can disrupt sleep, pets, noise, and so forth. The other is that for women who have hot flashes, who aren't at night, who aren't bothered by that or the heat, they can figure out ways to get back to sleep quickly. If the issue is staying awake and not being able to go back to sleep, then strategies to help them get back to sleep quickly are important, and that can be sleep hygiene strategies, getting out of bed, trying to cool themselves down, not looking at the clock. Those are really key strategies. The other thing, of course, is to prevent the hot flashes, and for women who have bothersome hot flashes, prevention is key. And there are different ways to prevent hot flashes. There are some educational behavioral treatments that people can cognitive behavioral treatments for menopause, which are education oriented. There are also strategies in terms of lifestyle management, which for some people avoiding alcohol, avoiding cigarettes, that can make a big difference. I think the women, and there's some dietary strategies, for some women, treatments like soy or other phytoestrogens can make a difference. But a lot of women, that's just not enough, and they really are waking up repeatedly. And then there are medications that are helpful for them. And of course, estrogen therapy is very, very effective for nighttime hot flashes, night sweats, and will improve sleep in those women. Not everybody can take the hormones, and if they can't, or if that's not the route they'd rather go, then there are other options, some of which are FDA approved, some of which we just have wide experience with, and that includes the serotonin-based treatments that were originally proven as antidepressants. But
what's an example of that?
So there's a whole class of serotonin-based treatments. They're SSRIs or SNRIs, and the most widely and most commonly used one is called venlafaxine or Effexor. But they all work, and one of them is FDA approved, which is a low-dose paroxetine. It's an SSRI. They all work, and so if somebody has taken one for other reasons, and they work in people not by treating depression, because these are not depressed people, but they work in ways in the brain that we don't understand to suppress the hot flashes.
Anything else you'd like to add?
Yeah, and another strategy is a medication called gabapentin, which is another widely used medicine for hot flashes that is used initially for treating seizures or pain conditions, but we've found it to be helpful to treat hot flashes. So I would say people should, talk to their doctors and talk to their friends and family members, and implement strategies that can really help them, manage their sleep a lot better.
Thank you very much.
Yeah.